Hi, this is Dr. Diegues again. So, if we start basically explaining a cough due to asthma, your presentation could be simply a cough. You might have some wheezing, which is a sound like that, mainly not when you breathe in, but when you're breathing out. And you might experience also some shortness of breath. Sometimes asthma is not only as a child, but can be started as an adult. You can have adult onset asthma. So a cough associated with wheezing, associated with a shortness of breath, is a little more towards an obstructive lung disease that could be asthma. Also, people that smoke can have emphysema, COPD, and the presentation would also be the same. So a cough associated with wheezing, shortness of breath, most of the time could be due to an obstructive lung disease that could be asthma or COPD. How do you know the difference? We do a pulmonary function test. Uh, Based on your history also, we start seeing risk factors for COPD because not only smoking causes COPD, there are other factors that could play a role. But if you have a cough, and again, as you go to see your doctor to get evaluated for this cough, have in mind that one possible explanation is that it could be asthma, or even if you're a smoker, older, it could be COPD. Have a good day.